Hello, everyone. My name is Katie Farrell, and I'm delighted to be here today to do this presentation on a virtual RCA simulation to improve patient safety. So just a little bit about myself before I begin. I'm an assistant clinical professor at Drexel University, and I teach in the graduate nursing division. I am also the track director for the Quality Safety Risk Management track, which is why I'm passionate about patient safety. I am a nurse for close to 20 years, and I received my bachelor's degree from Georgetown University. I received my MSN from the University of Pennsylvania, and then I received my EDD from Drexel University. So I'm not only faculty there, but I'm also an alum. So as I said, I'm delighted to be here today to share this presentation on our virtual simulation to improve patient safety. So I just wanted to talk a little bit about the objectives that you see here. So first, we're going to discuss how a virtual simulation can assist students to identify and address systemic issues affecting patient safety within healthcare environments. We're going to look at describing benefits for students participating in a virtual simulated RCA, demonstrate the effectiveness of simulation exercises in enhancing healthcare providers' competency and confidence in RCA simulation, and examine the role of virtual simulation in fostering a culture of continuous learning and quality improvement to optimize patient safety initiatives. So, as I said, this work was done at Drexel University, and I just want to share a little bit about Drexel University for those of you who might not be familiar. So you can see here that Drexel is located in Philadelphia. It was founded in 1891. We have, close to 7,000 students from all 50 states and over 20 countries. And within Drexel University, there's 15 colleges, including the College of Nursing and Health Professions, which has undergraduate programs in nursing, food and hospitality management, health administration, health sciences, human development and counseling, and nutrition sciences. There is also a robust graduate division of nursing that includes master's degrees in therapies, food and hospitality management, as well as multiple advanced degrees in nursing, where students can receive an MSN or a DMP. So within the graduate degree options is the MS and MSN in Quality Safety Risk Management. And that is the program that I teach in and also where this simulation takes place. So this degree is for nurses and also non-nurses, which is why it's an MS and also an MSN. And it's geared at professionals who are interested in a career that will impact quality and safety. This program prepares our students to lead organizational efforts for quality and safety, prepares them to function as quality safety risk management professionals, prepares them to apply critical thinking and diagnostic reasoning skills to evaluate and modify the quality and effectiveness of care, and to contribute to the advancement of healthcare and humanity. So this program is 100% online and it's also interprofessional. And interprofessional meaning that there are not only the MSN and MSN students, but students also take courses within the Drexel Klein School of Law. And those courses are taught by law faculty, and they are not only including the students in this program, but they also include students pursuing MLS degrees. So this is really great, I think, because students have the opportunity to learn about that risk management side of healthcare from law faculty who are experts in the field of things like HIPAA, compliance, and regulation. The students, as part of this program, are required to complete a culminative capstone project prior to graduation, and that's really a large-scale QI project applying the learnings from the program. And also what's important is that students are required to participate in a 2-day virtual RCA simulation related to safety. And that's what we're going to talk about today in this presentation. So before I get into the simulation that we do, I want to share a little bit about why this is important, looking at patient safety. So patient safety is really a national issue and it's actually become an urgent national issue. According to recent data, approximately 1 in 4 Medicare patients experience adverse events during their hospitalizations, with many of those patients and those events resulting in serious or fatal outcomes. More than 40 of these events have been determined to be due to preventable errors. So it's really important that we are taking a proactive approach to safety to prevent these preventable errors. You can see here on this slide also, the FDA received more than 100,000 reports annually of suspected medication errors. And these errors really tend to be the result of broken systems or ineffective structures and processes within the healthcare environment. When we think about this patient safety being an urgent issue and all of these reports of preventable errors and also medication errors, an RCA is something that is done when an error occurs or when an adverse event or a near miss occurs. And a root cause analysis is really a systematic process of identifying the cause of a problem or error as opposed to just fixing an issue. So if you think about it, it's really easy to put a band-aid on something and hope that it fixes something. But a root cause analysis really forces us to identify the root causes and to really look at ways to make meaningful and lasting change. So this presentation is really going to be talking about a simulation that's done related to an RCA. And why simulation? So the use of high fidelity simulation has been shown to increase knowledge retention and increase an understanding of systems thinking and quality improvement, all which are really important when we're looking at patient safety and RCAs. Simulation promotes having the students form experiences through active participation in their learning, which then can lead to the construction of new knowledge. There is a term called a flipped classroom, and the development of this flipped classroom simulation-based curriculum really maximizes the effect of online learning and can result in a more standardized active learning environment to address barriers related to education, and in this case, patient safety education. Simulation is really an effective strategy to promote social interactive learning in order to construct knowledge through a learner-centered environment. And, simulation is really important. And I will say this, before 2020, Drexel University used to bring online students to campus once during their academic program for a simulation. However, when the pandemic hit, the unforeseen challenges with that pandemic really led us to transition these in-person simulations to the virtual space through the facilitation of video conferencing software and the incorporation of standardized actors who were acting virtually. So this transition has really to the virtual setting has really proven to be a positive change as students found that the virtual simulations really replicated real life world scenarios, enabling them to really apply their classroom knowledge, but also foster that deeper sense of connection with faculty and peers, even though it was done in a virtual setting. So they really didn't feel that there was missing a beat going from in person to virtual. So the course that the simulation takes place in, the simulation that we're going to talk about, it takes place in a course that is one of the last two courses that students take. So at this point, they've learned the fundamentals of patient safety. And in this course, they are introduced to some new concepts, such as AHRQ's team steps, but they're really reviewing concepts discussed in other courses, such as human factors, systems thinking, transparency of errors, and some of the QI methodology. The simulation takes place over 2 full days, and students are notified when they're admitted to the program, and they're also giving well advanced notice on the days since the program is online that the students are aware of when they need to be available for these 2 full days. Yes, it is online, but students still need to be at their computer and present. So students are matched into groups of 2 or 3 to work together through the simulation. The introduction videos are really valuable. So in the course, we do student introduction videos, and those are really valuable to the faculty when selecting partners and groups so that students can be matched with classmates of different clinical backgrounds and different levels of quality and safety experience. So as I said, the simulation takes place over 2 days, but there's a lots of moving parts. And here are the parts that I'm going to review in detail soon, but I just kind of want to go through the phases of the simulation. So first is the pre-work, and this is when students have the opportunity to review documents to prepare for the simulation. Next is the orientation, and that's where the students are introduced to the safety event that they're going to be investigating. Then there's the pre-investigation for students to begin to investigate the event and gather information that'll be helpful in the interview that will take place. Next, the interviews and encounters, those are really the heart of the RCA. That is when they are talking to the people and doing the investigation. Then after the interviews, day one is complete. And day two will begin with your group. So whether it's your trio or your pair, analyzing their findings, then presenting their recommendations. And then the simulation, the 2 days ends with a debrief or review of a complex event. And that is led by the faculty, which in this case is me. So before I start discussing the steps of the simulation and how we implemented this virtual simulation, I want to share a little bit about the patient event that the students are investigating. So the students are introduced to this event that involves a 72-year-old otherwise healthy patient is admitted to the ICU for atrial fibrillation. On admission, a verbal weight is taken by the nurse, and that leads to a medication overdose and results in a bleed. The family is notified about the event. They monitor the patient, and ultimately they withdraw care and they want answers. They want to know from the hospital why this happened. And this is where the simulation comes into play. So the pre-work. So as I said, want to start, pre-work is before they even come to the simulation. And the first thing we do is share the schedule for the 2 days so that the students know what to expect. The students are expected to be fully engaged online with their cameras on the entire time that we're together. So we want them to kind of know when their breaks are so that they can plan accordingly. There's also high-level materials shared with the students to review prior to the simulation. And some of these things include AHRQ's event investigation and analysis guide, interview guidelines. So at this point, they don't know what the event is or who they're going to be interviewing, but they do review these interview guidelines just to really understand best techniques for interviewing in an RCA or really in any type of interview. They're also provided with the Just Culture algorithm and decision guide, which is, a strategy at not placing blame on individuals, but really taking a look at all the systems and processes. And they are also introduced to the AHRQ Candor Toolkit, which is all about communication and optimal resolution, which is, kind of what we call transparency and disclosure. The students also, as part of their pre-work, have to confirm that they have access to the simulation platform because the simulation will take place via SimIQ. So we want to make sure that they have access to that so that there's no technical difficulty the day of. And they want to make sure that they have a functioning laptop with a camera. So it's important that they do all this pre-work so that the 2 days together can really be, a seamless 2 days and valuable learning opportunities for the students. So day one, as you can imagine, the students are a little bit nervous because they're not provided with a lot of information on the specifics of the day beyond the schedule. And, being nurses and healthcare professionals, they tend to be planners. So I think that kind of unknown can give them a little bit of angst. So to start the day, we do a review of the agenda and objectives, and then we jump into an icebreaker. And the icebreaker is really important because, as I said, this is an online program, and the students have, seen each other virtually. They've responded to one another in discussion boards and, via video posts, but there's not regular live interactions. So the icebreaker is a way for them to get to know one another a little bit. But it's also related to implicit bias, which is going to play an important role in our simulation. So, the icebreaker, what we do is we present four individuals with different characteristics and traits, just bullet points about that individual. And then the students are asked to describe who that person is to them. So they take a little bit of time, they, jot notes, kind of create a mental image, a mental story about that individual, and then they share them with one another. And this icebreaker really allows an opportunity for students to be vulnerable, and also become aware of that idea of implicit biases. Sorry, um, of implicit biases. Because what's going to happen is when the students are interviewing these different individuals who are involved in the event, they're going to be different people with different personalities and different physical characteristics. So we want them to be aware of implicit bias and how it exists, so that they, can kind of be attuned to them when they're doing their interviews. Then the students are introduced to the event via this video, which I'm going to share with you now.
Hello, my name is Judy Jones, and my father was a recent patient at Greenview Hospital. My dad was a 72-year-old man with a history of only mild heart disease, diabetes, some high blood pressure, and a history of prostate cancer. He came to Greenview after experiencing abnormal heart rhythms that you call AFib. He was stable when he was admitted to his room, and the plan was for you to determine the treatment plan that would be best for him. We got him settled into the ICU, and we thought he was safe. So my mother and I went home, really sure that you guys would be taking the best care of him possible. We were going to return in the morning and get him back on the road to recovery. Unfortunately, that was not the case. The next morning, we got a phone call, and we were told that he received an extremely high dose of something called heparin and that his prognosis was really bad. That was the only information we received. No apologies, no details of how this happened, nothing. 2 days later, there was still no change in his neurologic status, and we had to make the most painful decision in our lives to withdraw the care of my father and my mother's husband. How does this happen at a hospital like Greenview? We are devastated at the loss of my father and my mother's beloved husband. We are so confused about what happened. All we want and really need right now are answers. How did this happen? And how are you going to make sure that this never happens again?
So that is how the students are introduced to the event. And I think it's really important because you can read about a safety event, but when you have a person who is obviously a faculty member acting as the family, um, do that, kind of, I need to know why, what happened. This is my father. This is my mother's husband. It really does personalize it, which is important for these MSN and MS students. So, after being introduced to the video, as a group, we discuss what an RCA is. We talk about, has anyone ever been involved in one, whether as a leader or actually as part of the investigation, asking them how they felt, really as a group with me as a faculty leading it, just kind of talking about RCAs. Because, like I said, these students have been learning about all of these concepts, but some of them have never done this in real life. So, we don't want them to be worried about the simulation. We want them to be, excited about it and feel prepared. We also talk about how the purpose of an RCA is not to blame, but really to get as much information as the event, about the event as they can, to really understand the circumstances leading up to the event, the culture of the hospital, and really structures and processes in the hospital and on the unit. So then the students are put into their pairs or trios, and they're given access to documents to support their investigation as they prepare for the interviews. So they're provided with mock hospital policies that are applicable to the event, including medication policies and assessment policies. They're given access to the patient's medical record where they can review the documentation while the patient was at the hospital. They can review patient information. They can review lab work, EKGs, vital signs, progress notes. So they really get to kind of immerse themselves into the patient's EMR. They're also provided with a high level timeline to help piece together what they learned from the family and in the chart. And this is important because watching that video from the family, you don't really get a lot of information. And with the chart, it's not going to be perfect documentation. So we do provide them with just a high level so they can help piece it together. They also take time again to review those interview guidelines. So now they know more about the event and they know who they're going to be interviewing, so they can develop specific questions for the different healthcare professionals that they're going to be interviewing. They're also, again, going to be looking at, as their group, whether it's a pair or a trio, looking at that just culture algorithm and looking at some of the QI tools that they'll be using when creating recommendations for improvement. So some of those tools are like a fishbone, impact chart, timeline, just things that they're going to need later. We want to have them looking at it early on. So after preparing for the interviews, then the students meet with the simulation center team. They're provided with a pre-brief, and then they log into the simulation platform to prepare to interview the 6 standardized patients. These standardized actors have been trained by me on their specific roles, and they're really told how to act, how to direct the conversation, and things that they should share during their interview. The 6 roles that are interviewed are seen here. So you've got the admitting nurse who is, kind of a seasoned nurse, been there, I think, for 20, 25 years. They're a little cocky, taking no blame. You have the nurse who administered the medication, and this nurse is petrified of being sued. They're petrified of being fired, and they're very emotional. You have the ICU attending who is pretty angry at the nurses and just feels that they are completely incompetent. You have the pharmacist who feels undervalued as part of the team and really doesn't know why they're here and makes it clear that they don't know why they're here and they're annoyed to be here. We have the IT director, the informatics director, who kind of has that Monday morning quarterback mentality, saying how they would have done things differently. But, they're just being consulted now after the fact. And then finally, you have the nurse manager who's really trying to shift blame from nursing to any other department because they don't want their unit to look bad. So they interview each of these individuals for 15 minutes long. And you think 15 minutes, you might think it seems long, you might think it seems short, but it really does fly. Getting their questions out, redirecting, when you have someone who's just trying to blame everyone and not give you answers, it can be challenging. So in 15 minutes, they really want to get as much information as they can. And they really need to be, asking the right questions and really supporting the individual to get the answers that they want. So after the interview is complete, then there's 5 minutes of actor feedback. And this feedback is verbally given to the patient, to the student, and it's also documented on a checklist for data collection by me. But the feedback is really related to how the student made the actor feel. Did they introduce themselves? Did they explain the purpose of the RCA? Things like that. And then once the interview and the feedback is completed, then there's a 5 minute break for students to regroup and, kind of gather their thoughts before the next actor enters the room. So the students stay in that one room and then the actors rotate in and out. The interviews and feedback are recorded. And this is really great because as faculty, I get to review them to see how the students, did in each of the encounters, but also the students get to review themselves. And they really appreciate this. I think it's a little intimidating at first, but they really enjoy the opportunity for students who have never conducted an RCA to review how they did, but also students who work in quality and safety and do RCAs a lot. They say they've never gotten feedback on how they conducted or how they do an interview or an investigation. So this is really an opportunity for them to not only get that feedback from the actor, but also review and have the opportunity for self-reflection. During the interviews, while all the students are on this SimIQ platform, myself and the simulation center team, we stay in the main Zoom room just should any student concerns arise. And then after the completion of all the interviews, the students come back to that main room. We do a quick check-in. I just want to make sure that everyone feels safe, feels at ease. This could be emotional for some of the students as they're going through these interviews. So we do a quick check-in to make sure everyone's okay, but we don't do a full debrief because the next day is continuing into the simulation. But once I make sure that everyone feels safe and at ease, they're dismissed for the day. Then the next day, day two begins, and we start the day similar to how we started the first day with faculty providing an overview of the day and providing some guidance on how to do your analysis of finding, how to do action plans, and how to prepare their presentations. Since each of the group may have had different experiences with the different actors, depending how their questions went, they're reminded that we're going to debrief later after the simulated board presentations. But until our debrief, we really don't want to talk about the specifics of each of our experiences and each of our encounters and interactions. So it can be a little challenging because students want to talk about, how their interview went with the nurse manager or how it went with the physician. But we really do say, just hold off. We're going to get to all that at the end. As part of the guidance, because I want to make sure that the students feel prepared, I remind them about things such as rules of causation and really focusing on systems and processes rather than individually blaming one person or another. We also review Reason's Swiss cheese model that discusses how each piece of cheese with the holes in the Swiss cheese is really a latent failure. And when they line up, it's a perfect storm that can lead to harm to the patient. Students are also given kind of a list of things to include into their presentations and templates to use for the QI tools because I don't want them wasting time trying to come up with a timeline template or a fishbone template. I really want them to be focusing on their analysis of findings because when it comes to the presentation, they're really expected to present an overview of the event, the root causes for the error, and then an action plan for improvement, looking at short-term and long-term action items. While students are preparing these presentations, the faculty are then going in to review the student encounters because, as I said, they were recorded so that we can provide them feedback on their encounters. So again, they get that SP feedback, but then because they're recorded, they also get my feedback, which I think is helpful for the students. So next, the students, once they've kind of created these presentations, they have the opportunity to present their findings and corrective actions, recommendations for improvement to a simulated board. And this simulated board consists of faculty, so myself and other faculty who teach in the College of Nursing and Health Professions, and also our quality, safety, risk management advisory board members. And these advisory board members are subject matter experts in the field. So many of them, really all of them, are working in quality and safety at different hospitals across the country. So they're really familiar with safety events. They're familiar with root cause analyses, and they're also familiar with the best way to present findings and also the best type of action items, taking into account, long-term versus short-term action items, taking into account, feasibility, taking into account cost, finances, things like that. So the students have 15 minutes to present their findings and presentation. And then that is followed by 10 minutes of question and answer, where the leadership asks questions and they ask questions about the plan acting in specific leadership roles. So, for instance, if they have a question from the nursing perspective, they will introduce themselves and say, "Hi, I'm the CNO of Greenview, and my question is, X, Y, and Z." Or, I am the chief financial officer, and I have questions about the feasibility of adding new equipment, knowing how our financial statements are right now. So they really take on the leadership roles, but when they're asking questions, they take on those specific roles so that they can ask questions, that would be asked in a real uh, board or leadership presentation. So these presentations are really a great opportunity, one for exposure to what a real RCA presentation would be like with leadership, because everyone is respectful, but there will be questions about the decisions made. And some of these questions are going to be hard. Like I said, if a student is proposing something that is not fiscally responsible, then there is going to be questions about it. So it's a great learning experience for students to see what these types of presentations are like. But it's also a really great opportunity for them to practice presentations because we have some students who, work clinically. They're not working in leadership. So they may never have done a presentation at their hospital or organization. So this is a really great opportunity to do that in a safe environment. So after the presentations are complete, then I say the students can take a much needed breath because I think it's been a long 2 days, but valuable 2 days, and a short break before we then meet as a group. So then the advisory board leaves, the faculty leaves, and it's really just myself and the students. And we hold a debrief that we refer to as a review of a complex event. And the session begins with a reframing on what occurred over the past 2 days. So, reminding them, we met with standardized actors to gather data, you developed action plans based on the data, and you presented your findings and plan. Then it's followed by a refresher on the basic assumption at Drexel. And that basic assumption is that we believe that everyone is intelligent, capable, cares about doing their best, and wants to improve. And this basic assumption was shared with them in the pre-brief before they started their interviews. And then we like to follow back with it before we get into this type of debrief with the students. During this debrief or review of a complex event, we explored two important questions. Those questions are the influence of personal perspectives and past experiences on the encounters. And this question really usually leads to rich discussion and dialogue surrounding implicit bias, and how students, felt a certain way towards some of the actors because of these biases. For example, some students have said, I was in the same situation when I was a nurse. I made this mistake. So I completely empathize with the one nurse. Or I've dealt with nurse managers just like that. So that person immediately made me like get my guard up. We also discussed the influence of emotions, and students shared how, sometimes they placed less blame on actors who were scared and crying because they felt bad for them. And they realized that this isn't the right way to handle things, but at the time they couldn't help themselves. So it's a really great way to reflect on their experiences during the encounters, and talk about, how biases play a role and also how emotions can play a role. The students, excuse me, are very open to being vulnerable and sharing in the group because at this point they've spent the last 2 days together, so they really have gotten to know one another better. Finally, you can see feedback for faculty. So the students provide feedback on the experience. So what went well, what they could have done differently, and then really one key learning from the simulation that they'll take with them into their professional practice. Besides the discussion during the debrief, there's formative and summative evaluation, and that evaluation is used to further expand and refine the experience for future students. So students report, they have a reflection and peer review form, and they've reported that the realism and practice relevance of the experience has been really helpful in building skills and also building self-confidence. Faculty who observe the students in the interviews recorded and also in the presentation have noted that the students exhibit growth in knowledge and understanding. There's also anonymous evaluations that are completed after each simulation. And these evaluations show that students really enjoy tying the learnings of the program into a real life event. So they admit that they were really nervous. They didn't believe me that it would be fun, but they really, really did enjoy it. One student shared with me, and I quote, Without this sounding corny, I really enjoyed everything yesterday and today. Working with blank was especially great because I got to pick her brain about her work experience. The interviews were so realistic. And although I was nervous about conducting them and receiving feedback, this whole experience further assured me that I'm in the right track for my future. I was so excited to share with my family that I'm actually excited for a future career in quality, safety, and risk management. So that's just one example of students sharing how impactful this type of virtual simulation is. So when we think about implications for practice, the use of virtual simulation for this type of learning, or really any topic, is valuable for practice. The use of virtual simulation, is a useful method to engage online graduate students to prepare them for a career in patient safety. This type of simulation is not only an opportunity for authentic assessment, but as I said before, it provides students with confidence in their knowledge and ability, and in this case, related to safety and how to prevent medical errors. This virtual simulation really helps students develop skills related to QI methodology and RCA investigations. But if you were going to do a simulation for a different field, it would still be applicable in developing needed skills in that field. As I said before, many of the students have never had the opportunity to present to leadership. So this gave them that opportunity for creation of a formal presentation and then the presentation itself in a safe space. Since 2020, many RCAs and hospitals have been occurring virtually. What we found was when things were shifted virtually, it actually helped get people to attend because if a nurse was off, maybe they wouldn't want to come in to attend an RCA. So there has been a shift that these are actually being done virtually. So this really prepares students for how to do these types of interviews in a virtual setting where it's a little bit more challenging to connect with the people you're talking to when you're not in the same room and you're a box, in an online platform. These simulations, like I said, used to be done on campus, but the pandemic really forced us to pivot to the virtual setting. But this change was really well received. I think that students really appreciate the flexibility of not having to travel while still reaping the benefits of simulation. The transition proved to be positive as students found that the virtual simulations, even though they were being done virtually, they still replicated real world scenarios and they enabled the students to effectively apply that classroom knowledge while also fostering a deeper sense of connection with their faculty and peers. Consequently, like we really believe that online programs in a variety of disciplines um, could benefit from these virtual simulations. So this was obviously really related to quality and safety and to students pursuing master's degrees. But I think the use of virtual simulation can be used really in any healthcare education, but really, I think education beyond. There's always times where students need to learn something that they're going to do in real life. And doing simulation is such an important tool. And when you can do it virtually, I think it really, you don't miss a beat. Students felt that it was equally valuable, even not being in person, and also a cost-effective alternative to not traveling. So with that being said, I'm going to open it up to questions. And I also do just want to share my references here. But again, now we're going to open it up to questions, and I look forward to hearing from all of you.